like to talk a little bit about gynecomastia today. So what exactly is gynecomastia? Well, simply translated, this word means female appearing breast. So gynecomastia is a term used for an overdevelopment of the breast in a man. Well, what causes gynecomastia? There are some unusual medical conditions that can cause this. Smoking marijuana, taking things like steroids or some other medications can cause gynecomastia. But the reality is, the great majority of the time, this is a benign condition with no identifiable cause. So how is gynecomastia treated? Well, it depends on exactly what is contributing to the enlargement. Enlargement of the male breast can be caused by fatty tissue, it can be caused by more tough fibrous tissue, and there can also be excess skin. So it depends which of these three contributing factors is causing the enlargement. Sometimes it could be just one, sometimes two, and sometimes all three. Excess fatty tissue responds very well to ultrasound assisted liposuction. This can be accomplished through very small incisions through the side of the breast area, leaving almost no visible scarring. If there's more tough fibrous tissue, this usually involves a more direct surgical removal, and the scar in the incision is usually a little bit larger, and the location on the breast depends on where the fibrous tissue is. Lastly, if there is a lot of excess skin, the skin itself could need to be removed. This involves the most amount of incisions and the most amount of scarring. So as you can hopefully understand now, it depends on what exactly is going on. A very common question we get is somebody calling stating they have gynecomastia, and what is it going to cost to correct this? Well, the reality is all of the operating room staff, the nurses, the technicians, the recovery room staff, the anesthesiologists, they all get paid by the hour. So the longer the case takes, as you can imagine, the more it's going to cost to treat it. Sometimes there's gynecomastia involving only one side, and sometimes on both sides. Sometimes it's just fatty tissue, and sometimes it's an excess of skin and a harder mass and fatty tissue. So the best way to sort all of this out and figure out what's causing the gynecomastia, what's the best way to treat it, and what the cost is going to be to treat it, is to come in and have a consultation by a board-certified plastic surgeon who does a lot of gynecomastia treatment. Hopefully that makes sense, and hopefully that was helpful. Thanks for listening.